Good afternoon, everyone. Thank you for joining us today as we take a deep dive into how organizations in St. Louis are using a public health approach to create safety. I'm really excited about today's conversation because it highlights the incredible work being done on the ground to reimagine what safety looks like in our communities. For those of you that I haven't had a chance to meet yet, I'm William Simpson, and I lead the community safety and justice work at Equal Justice USA. I'm here today with my friend and colleague, Colleen Cunningham, who is a senior campaign strategist at EJUSA and has been deeply involved in our work to support local organizations in St. Louis and across the country. We're really excited to be here with you all. At Equal Justice USA, our mission is to build new responses to violence that help communities foster real safety, healing, and accountability. Right now, most of our systems are focused on punishment after the fact, but we believe true justice lies in preventing violence before it starts and addressing the root causes. We promote a new vision of justice in several ways. First, we partner with and resource frontline organizations that are directly involved in anti-violence and healing work. We know that those closest to the problem should be closest to the solutions, so we work alongside these organizations to ensure they are well equipped for success. Second, we create healing spaces for frontline workers. The work they do is often in response to deep personal and community pain, yet they don't always have the time or the resources to take care of their own healing. We're committed to supporting these change makers by providing them with the spaces and practices that they need for their own well-being. Another critical part of our work is changing the narrative around violence, especially by confronting the racial injustice that is embedded in the current system. We have to be honest about how violence and danger have been historically and wrongfully attached to Black skin, and how the legacy of slavery is deeply connected to our criminal legal system. At EJUSA, we believe there are solutions to violence that go beyond sending in more police. Our work includes leading policy campaigns to ensure that laws and budgets at the state, city, and federal levels support community-led solutions to safety. Today's discussion is a perfect example of what this new vision of justice can look like in practice. And I look forward to learning alongside all of you as we explore how these organizations in St. Louis are creating safety from a public health perspective. As we go through today's conversation, please feel free to drop any questions you have in the chat. We'll do our best to address a few of them towards the end of today's discussion. So with that, let's get started. And Colleen, I'll hand it over to you to kick us off.
Thank you so much, Will. I want to start with saying that I am a proud St. Louis native, and for the last couple of years have had the great privilege to work in St. Louis with dozens of incredible nonprofits who are working to build community safety and healing. St. Louis boasts some truly remarkable programs and leaders, and I'm thrilled for this conversation today with a few of those amazing community leaders. We're joined today by Miss Lisa LaGrone, founder and executive director of Safe Streets, Safe Neighborhoods, Dr. LJ Punch, founder and executive director of Power for St. Louis, Power for STL, and the BRIC, and violence interruption expert and trainer Marcus McAllister. I want to frame this conversation with the reality that the community safety ecosystem building that's happening in St. Louis, with leadership from the city, the Office of Violence Prevention, and these incredible community-led organizations, is seeing real results. For the last full year on record, St. Louis had the fewest homicides in a decade and major drops in every category of violent crime. I'm going to start our conversation with my friend Lisa LaGrone, founder and executive director of Safe Streets, Safe Neighborhoods. Her team responds immediately to shootings and other violent incidents throughout the region to de-escalate the scene and provide direct support as well as service referrals to victims, their families, and the impacted community. Lisa, you have been a leader in the St. Louis community for decades. In fact, in 2022, you were invited to the White House to receive the Innovator Award from our friends at Cities United for, quote, your work on the front lines to create safe, healthy, and hopeful communities for young Black men and boys, their families, and communities. Can you tell us a little bit about the work that you do with Safe Streets, Safe Neighborhoods, how your life brought you to the place of doing that work, and how you've seen the work to build community safety change over the years?
Okay, hi everybody. My name is Lisa LaGrone, and I'm the CEO of Safe Streets, Safe Neighborhoods. I've had the pleasure of working with some very, very important people in St. Louis. I need to start out by telling you all my story. I once upon a time was part of the problem. that was going on in St. Louis. I was, in the streets. I was working, but I was in the streets, and we were doing things that we really weren't supposed to be doing. Back in July the 17th, 1991, my father was killed in a drive-by. Him and 11 people were shot that night. And that's the first part of trauma that came to my life when I lost my father, because my father was real important in my life. 10 months later, my little brother was shot 7 times in his back. It was a domestic violence case. He caused some of his death because he was putting his hand, because I'm a real person. I just tell it like it is. He was fighting a girl, and her brother got mad, and he shot him 7 times in his back. So I know what it is to lose people. I know what it is to be in the streets, and I know how they, the community, they think. I've been on both sides. I'm an activist also. That's a part of my life, even when I'm doing this work that I'm doing. Back in 1996, I was working with the health department. They came to me and asked me would I be able to run this program they bought to St. Louis called Safe Futures. It was a game program. It was a federal program, a $5 million grant for 5 years. And we did that program. It was a pretty good program. Matter of fact, people say that Cure Violence was the first one that started, but not really. Safe Futures was just like Cure Violence. As a matter of fact, Safe Futures was more, it was more balanced. It was more structured. And everybody from different agencies got together. We all worked together, and we did that program. Well, St. Louis did so good that the White House gave us $2 more million. And so, but I still, once the grant was over, I still was working in the community, still doing things, and I kept in touch. And so about 4 years ago, Jamala Rogers came to me from the Organization of Black Struggle, and she was like, Lisa, they bringing another program here called Cure Violence, and I want you to sit on the board. I want you to look at, see what we could do to make things better, make it right, that it, and so they bought Cure Violence here, and it did pretty good. It was a good program. Some things happened, and Jamala ended up starting our own program. It was called Project Haki. So I had a team of people, like this 3 or 4 people, and we went out on the street and we responded to a lot of shootings. And I was seeing that responding to these shootings, we weren't really bringing the resources that we needed. And that's where we got in contact with the Office of Violence Prevention. That's where they came in, kicked in at. I might be going too far because I'm thinking so hard. But yeah, I was trying to develop my own resources to people, but it was becoming overwhelming. So when we got involved with the Office of Violence Prevention, that was it kicked in. And so that's my life, y'all. I'm not really a good speaker. I mean,
You're a very powerful speaker, Lisa. Thank you so much. Yeah, thank you for who you are and all that you have done in the community for years and years. You're really a pillar of so much that's happening in the region. Yeah. I'm gonna pass back to Will.
Awesome. Thank you, Colleen and Lisa. You're a real champion for the work that's happening out there. And thank you so much for the things that you do. And we're gonna get back to you a little bit later in today's conversation to learn more about what's happening and what's on the horizon for the program Safe Streets, Safe Neighborhoods out there in St. Louis. I'm actually gonna go now to my brother Marcus McAllister. Marcus, as the work around addressing violence continues to grow both locally and nationally, we've increasingly heard the call to treat violence as a public health issue, right? In June, for the first time, the U.S. Surgeon General officially declared community violence a public health crisis. Wondering, how does this declaration resonate with the work that you're doing across the country, but also in St. Louis, right? Because you have a footprint there as well. But before you dive into that, I'd love for you to briefly introduce yourself and the work you're leading, right? I know you're connected with the CVI LA out of the University of Chicago, and I've had the pleasure of sharing space with you and seeing firsthand, right, the incredible work you've been doing in communities across the country. So yeah, if you could share a little bit and then speak a little bit more about this idea of violence as a public health issue.
Sure, I'll be real brief just on a little bit of who I am in the space. I'm someone that's been a practitioner doing this work for about 21 years now. I'm a person that come from lived experience. So early in my young childhood life, I've made some bad decisions myself and served almost 10 years in federal incarceration. And coming home from prison, back in early 2000, here in Chicago, where I'm based, when I'm home, they had a program called Ceasefire Illinois, ran by a friend of mine, Mr. T.O. Hardeman, connected with Dr. Gary Slutkin and the whole thing. It changed his name to Cure Violence, et cetera. Did that work for some time, about 18 years. And over the last 4 years, going on 5 years, I launched McAllister Consultancy and Training. By having a couple decades of experience, knowing the work, I started to launch myself out. And as you mentioned, I work at the University of Chicago. I'm a dean of students for the newly created Community Violence Intervention Leadership Academy that we're so proud of, that we have launched and continue to build out practitioners and stuff. And, I'm someone that's been in the space for so long. I know like quite a few people. Everybody knows me by that. You can call on me if you need to get connected. And I like to network the people in this space to grow and grow. But and so that's a little bit about me. You all, father, family man. I'm even a pastor. Who would have thought that? But God is good. But when you say the public health approach, obviously my early career was Ceasefire. We were looking at violence from a public health lens. But I'll tell you, with the Surgeon General making that an announcement, I think that was great. That's something we didn't already know. But it helps to have the highest doctor in the land stamp it as a health issue, and going around the country and pushing for funding and stuff, that helps us, right? I worked alongside with some colleagues in the Fund Peace movement where we were pushing policy and legislation, which got some of the money from the Community Safer Act, as well as the ARPA dollars. And so I've been a part of that, and all our language has been the same. This is a public health crisis, so to have that happen, great. I'll even go back just a little bit. When COVID hit, that also really showed what we had been saying, that, when COVID hit, the resources came, the cross collaboration came, it was comprehensive, it was, holistic, and to the best of his ability. That was the mind state. And that's the mind state we had to have with violence. And we've been kind of pushing that. And even to my good sister, Lisa, what she said, her even back then being innovative in their way of looking at things comprehensive. We're just now getting in a space where we're really pushing that. I come from a space where we're just trying to get the violence down, put your head to the ground. That's why we train like we train. Let's deal with the immediate. But we always knew that you needed resources. You needed all those entities that they give to other health crises, right? You know what I'm saying? You need the Dr. Punches of the world. You need the hospital programs of the world. You need the school program. And so I'm one that has evolved to see the importance of that. So it's an honor to be a leader in pushing a comprehensive public health approach to violence, and how it has to be a little bit of everybody. And as I said at Cities United Conference years ago, the only thing I really like people to know is just imagine a big pie. There's a lot of slices that's going to be in there. Sometimes all the slices ain't the same size, but we all come from the same thing. We all want the same objective. And that's kind of how, when you look at things from a public health approach, I'm sure the people that, let's get with COVID, the people that were doing the social distancing campaign or whatever it may be, weren't they're doing their part, right? And somebody else was dealing something with, whether people are taking the vaccine or not, and all the different pieces. And that's kind of what a public health approach does, and to have it stamped, that's how we look at it. Lastly, I'll say you look at the opioid crisis, and you look at the crack era. The crack era was looked at as a criminal justice issue, whereas with opioids, it's looked as a health. So what do? They give police Narcan, and they do these resources, and they're educating more, and they're doing what we're doing now. Hell, in my time, there wasn't no webinars and education. That is a part of the ecosystem, like people learning. So I respect everybody that gets on here to take from this seminar, from this thing that we're doing here, and taking that information and, and giving it back to your folks in your respective cities, Will.
That's beautiful, Marcus. Thank you so much, brother. I mean, you dropped a few gems on us there. I really want to lift up two big pieces. One, when you talked about, like, it was great that the Surgeon General said that, but folks have been doing this work in communities with that lens for years, right? This isn't new. And so that validation is great, but we really need to lift up, right, the fact that this work has been happening through a public health lens for so long. And then you use the word ecosystem, right? And so I love the pie analogy, right? Look, we got a pie and everybody's got a slice of the pie. Some slices may be bigger at some points, some might be smaller at some points, but we all have to actually contribute to that pie. And when we think about this idea of addressing violence through a public health strategy, it's really, right, addressing some of those root causes, right? And understanding if we're going to stop violence, let's get to the heart of the matter. Let's address the things that are actually precipitating the violence. Let's go upstream so we don't have to come downstream and then try to fix and work with people to heal. If we can go upstream and think about what healing looks like, how we're getting folks employed, right? How are we building community? How are we building relationships to the nonprofit and to the faith-based community, right? Those are all critical components to addressing some of those root causes, because we know when people feel well, when they feel connected, when they feel secure, they are so much less likely to actually be engaged in violence. And brother, I've seen you in so many different spaces really lift all of those things up. So again, just really want to thank you for the work that you're doing. And as I said to Lisa, we're gonna get back to you in a few minutes, brother, to hear some more about what's going on. And I definitely want you to tap in on that CVI Leadership Academy a bit more too, because it's a great opportunity that folks really, really need to know about.
100%.
Colleen, I'm gonna toss it back to you.
Beautiful. And I'm going to bring into this conversation Dr. LJ Punch, who is a trauma surgeon and the founder and executive director of the BRIC, the Bullet Related Injury Clinic. So Dr. Punch, as a physician doing this work on the ground in community with a public health lens, first I want to create space for you to add, if there's anything you want to add to this conversation that Will and Marcus have started about what it means to treat violence as a public health issue. And then second part is I want you to be able to tell anybody who doesn't already know about the incredible work that you're doing with the BRIC. How are you innovating? How are you doing things differently with the BRIC?
Well, thank you so much. It's such a joy to be here with y'all from EJUSA, as well as Pastor McAllister and Miss Lisa, people who have helped me learn. I didn't grow up in this field and in this work, and so I've learned a great deal from the community and the people here, so appreciate the chance to share. I'm a trauma surgeon by training. I learned how to be a trauma surgeon in Baltimore and I practice in St. Louis. Two cities that are exceptionally similar, and understanding the issue of violence and what it does to people and to bodies and to lives is actually something I've been digging into as a practice over the last 2 decades. And I want to use actually something that was already brought up around the concept of COVID, because I think it helps understand what I'm doing around understanding violence as a public health issue, and also very much not framing it as an issue of violence. So let's take COVID. I'm trained as a trauma surgeon, but also as a critical care doctor. And in the first several months when the pandemic hit the St. Louis region, I moved my practice to a community ICU and was intubating people, critically caring for people who were trying to survive this deadly virus before we really even knew what it was. I was providing a high-level complex care. I was also talking to families and trying to help them gauge how to expect the progress for their loved one. I was also working in the community, doing webinars on how to protect yourself. I was distributing PPE, and I was teaching people how to use things like nutrition and hygiene to protect themselves. I was also managing it with my family, trying to keep my children and everyone around me who would listen as secure as possible. And I was also taking care of myself. Now, some of those things, right, were public health. These are like structures, things, practices that can make it so people are more healthy. But some of these other things were around healing, and some of these other things were around care. I think the issue of gun violence is the same kind of issue. There are frameworks of approach that are really amenable to a public health approach as compared to, let's say, a criminal justice only approach, right? And so I think the way communities and organizations have used this lens, which is structural, which is human-centered, which is focused on helping people be well as a mode of prevention, I think it's beautiful and it's important. I also think inside clinical care, inside healing work, it can actually be problematic, and here's why. When violence is the issue, it makes people be the problem. And inside healthcare, inside healing care, people are never the problem. Every patient, no matter what side of the bullet they might have been on, is my patient. And I am here for them and their families all day, every day, to help them heal. Because in that healing, transformation is possible. So the beginning of the BRIC is the Bullet-Related Injury Clinic, the clinic I run in St. Louis now, that was founded in November 2020, is shifting not just the narrative, but identifying a new source of the trauma of gun violence, and that's the bullet and the injuries the bullet causes. So that's taking it a step further. That's not framing gun violence as a public health issue. That's framing bullets as sources of injuries. Now, injuries. Let's talk about injuries. Right now in the United States, 70% of the time, when someone is shot, they'll be seen in an acute care setting, an emergency department, and then sent out from that same department without being admitted to the hospital. They'll have an injury in their body that was deemed minor, not requiring surgery or hospitalization. They will then go to wherever they came from, a home or not. Maybe they're acutely housing insecure. Maybe they were housing insecure before they were injured. And they will then have to nurture their bodies, hearts, minds, and souls to heal that injury alone. Frequently, they aren't given the supplies they need, the support they need, the guidance they need to know how to take care of a war wound. And the way bullets impact our bodies, they tend to make our experiences worse in the days after we're injured due to our response of inflammation and our psychological emotional response of trauma. So basically, the care that people need 70% of the time is not provided to them when they need it the most. So for me, as a physician, as a trauma surgeon, the shift has been to not just recognize gun violence as a public health issue, but to recognize bullets as a source of an injury that is worthy and desperately needing care. So the BRIC is a place to provide just that. It is a medical home for the aftercare of people who have bullet-related injury, which is defined as the physical, emotional, social, and spiritual impact of a bullet, whether someone has been wounded, threatened, or lost their life to the bullet. And that's not just the person who has been directly impacted. It can be an experience that happens through someone you love. That's what bullet-related injury is, and that's what the BRIC in St. Louis is all about.
Thank you so much, Dr. Punch. It's so powerful the way you hold so many layers. It's both systems and individuals. It's the person who caused harm and it's the person who was harmed. And I think you're really getting to the heart of why at EJUSA we talk about it as an ecosystem. Until we have all of these pieces within us as individuals, all, humans contain multitudes, all of the health and wellness and wholeness we need as individuals, and then for that to extrapolate out to broader society, all of those components together, which is overwhelming and exciting because there's a role for all of us, and you do it so beautifully at the BRIC. So thank you for your work. I'm going to bring Will and Reverend McAllister back in.
Wow. All right. Love to hear Dr. Punch talk about that work. and specifically how, right, this idea of bullets and how they cause those injuries, right, and how we can address everybody that's affected by that injury, right? And I've seen this space in St. Louis firsthand. It's a beautiful space, and the work that's happening there is amazing. So thank you, Dr. Punch. Marcus, brother, I want one, right? Just want to leave some space too. If there's anything that you wanted to add on to what Dr. Punch just talked about, because I think it's so powerful just to hear how he talks about it and the work that's being done out there. But then also to hear a little bit about how you see the future looking around reducing violence in our country, right? Addressing violence as a public health issue. With the lens that you bring to the work, right? Because like I said earlier, you have the footprint, you're doing some work in St. Louis, but then also that perspective as a national practitioner, right? Somebody that's traveling across the country and sees all the different forms of the way people are going about addressing violence. So again, space for you to kind of just respond to anything Dr. Punch just said there. And then what does the future look like? And I think this would be a great place to really lift up the CVI Leadership Academy as well.
100%. Thank you for that, and Will. Yeah, I mean, I rock with Dr. Punch from the day I met him and understood what he was doing. I'm privileged. I get a chance to see what a lot of people are doing, and so I speak about Dr. Punch in rooms that he's not in. I'm talking about the BRIC. I'm talking about what you're doing, Will. Like we network over here. That's what we always been about. My name is solid for that. Like if you're doing something in this space, trying to make our neighborhoods and communities better, I'm going to be lifting you up. But in this case, what he just said, definitely unique. Me and Dr. Punch know a lot of the same colleagues. I work with a lot of even hospitals across the country that are doing work, and they're, if they don't know Dr. Punch, they've heard about him. And he mentioned Baltimore. I've been working in Baltimore for those 20 years, just being a part of their violence prevention efforts with their street intervention work and even some of their hospital work. So definitely always honored to network with Dr. Punch and hear his how he looks at it, and I think it's a great thing. It's actually a strong part of that ecosystem, as my sister, Risa Napier, would say. Even dealing with the trauma that the families suffer and stuff that beyond a bullet, beyond this. I say this in my trainings, like I've been training and pouring into this movement for so long, and I had my head so far down to the plow because we were just trying to stop bullets. And we dealing with the immediate. We knew about the preventative side, but I didn't know a lot of survivor groups. Yeah, I knew they were out there, but I didn't know them. I know more than ever now because it's like, I'm trying to meet all the different pieces of the ecosystem, and I want to see the holistic way of it. And I think to dive right into like the future of the work. So to start, let's just start with the CVI LA Academy. Our reason for starting that academy, myself and a few other colleagues that were part of our Black and Brown Peace Consortium, we came together, some strong individuals in their own right in different areas, from research to city government to myself, Dr. Chico, a bunch of other folks. So we really thought that it was necessary to have a national academy that's pouring into leaders to help them learn everything they need to learn about to be successful, to contribute to what that ecosystem is, to be able to see it, logic models, theories of change. But beyond that, and one thing that I speak about is honored to serve as the dean there, is the connection of networking and meeting other groups that's doing things in other cities. And so I see like an influx of people in the space really starting to know one another and connection of one another. Like I said, I've been privileged. To me, it's just like the university, the academy is like a big TA for me because I'm bringing people together. We got 30 students and another 30, and these are like great leaders, but they might not have known the people in St. Louis, or they might not have met somebody from Baltimore. And like the Bible said, there's nothing new underneath the sun. You have to be able to compare and see what other people are going through. So I see the future of the work being more networking. I see more education. There's documentaries starting to come out about the work. I see, much more collaborative stuff. I mean, New York is one of the best overall, I'm just using them as an example, when it comes to a comprehensive approach with all type of pieces involved and the money behind it and stuff. You have to have that. And I see cities are more and more doing that. And I work in quite a few of these cities, New Orleans and Milwaukee. I'm doing work in New York, Houston. We have programs out there, but they're not just programs. They have, I think in Houston, for example, they have the Access program, which is connected to their violence prevention work, which allows the resources of jobs and stuff and other things of that nature. And like, certain cities have CVI work. They might be doing some focused deterrence work, but they're also doing mentorship like the credible messenger work. I've been in cities where that has been going on, as you mentioned, Will, and I see more collaborative efforts between all these entities. I mean, they're all good stuff. Anybody that got a problem with a lot of things coming in to save lives, you're in the wrong space, because this is not Adidas versus Nikes. You ain't selling tennis shoes. We ain't competing like that. Ain't no, listen, and I love what Dr. Punch is doing, but if there was 5 other people that was doing great work and they was able to find their way there, I'm sure Dr. Punch would be like, great, because it's about saving lives, right? And so we push for people to learn as much as they can. So that's where the CVI comes in at. I think that is a big part. Another innovative thing that's going on now is and I'm a part of this myself, and I'll share with this group. So I have launched a train-the-trainer academy, and we are building out TTA providers throughout the country. I'm working in conjunction with a lot of different folks, Everytown, Annie Casey, my own self, University of Chicago, Dr. Chico, and we know that there's a need for help for entities to be able to get off the ground. And I'm honored to work here in St. Louis through the Office of Violence Prevention. A shout out to my sister, Lisa, who played a big role in bringing all that together, along with my partners, Live Free. And, St. Louis means a lot to me, Will. My family lives there. My brother stays in St. Louis. My mama's right across the bridge, and I've had people, that's why I'm always bold when I come to St. Louis, because although I might not live in St. Louis, it's my home too. I did used to live there. I do know the people on the ground there beyond even coming to this space, because I grew up right around in that area across the water in Alton, and would always come over to St. Louis. And it's been one of those things that it's been personal for me to be a national TA and trainer that St. Louis succeed. And I feel great about it. I mean, there's some things that we don't even have time to get into on this call, but there's a lot of moving pieces in St. Louis right now. I want to shout out the OVP and what they're doing and what Will Pinkney and them are putting together, the support they're doing for a lot of us on this call in different capacities, wanting to see a comprehensive approach. And there's a lot of talks of that getting bigger and bigger with different entities nationally included, to be of help. And then, and I'm honored that people are showing some interest in helping out, not just St. Louis, but also across the country, Will, as you said. It's a big thing. That's why I'm always Will's up, because everybody needs help and I can't go everywhere. So I'm building out this academy. We're going to have strong people. And if you need somebody to help work with you, you can best believe at my company, MC&T, we're going to be a good yellow pages for folks to have credible people that know what they're doing and come to your city and help you implement and be of any service that they could be. And I'm claiming that. And it's been happening as we speak in different cities that I got it going. So thank you.
Nah, amazing, Marcus. Absolutely amazing. I'm a Nike guy, but I appreciate your analogy, right? This is not Nike versus Adidas. This is all of us coming together to lock arms to save lives, right? Because for far too long, we weren't in position to do that, right? You had folks that were desperately doing it here, right? There was a pocket of folks over here doing it. But what we've seen, I think, over the past few decades now, are folks doing that, locking arms, right? Brothers and sisters coming together, folks like you that have relationships all over, putting the ego to the side, right? Figuring out how we can build together, what we can do to train those on the ground. I think it's amazing to hear that you got this Train the Trainer Academy starting as well. We need more folks versed in CVI, right? To actually engage with folks in their local communities and other spaces. Because right now, there's been a lot of resources. I think you might have brought up ARPA earlier, right? Tons of money got pushed into the CVI space specifically, but we didn't have enough folks to actually go into every community and help build things up, build these shops up, build the infrastructure in these organizations. So to hear about this new training academy is fantastic. And I also want to point people to the chat, Marcus, because you talked about the CVI Leadership Academy a few times. We put the link in here. I'm not sure when the next class starts. But I want to push folks to get on that website. Marcus, when does that next class start?
So the next class is starting in December. I believe we closed the application for that one, but there's going to be a new one open up. We have been pushing this. We're in cohort 2 right now. We're going to push this thing to cohort 30, if I got anything to say with it. So it's every 5 months, and then there's a 2-month layoff to the next cohort gets started. It's being evaluated, so we have to kind of have these. They just opened up for 3 and 5. I think they put the link in there. They can check and see if it's still open for people to apply. And this is executive directors, people that are running programs, some from all sectors of the work that want to learn more gain a quality insight from a bunch of experts, and we've done a great job in taking people around and took them to the DOJ, took them to the White House. Man, it's been phenomenal. Like, we have been really serious about building out the practitioners the best of our ability. So thanks for that, Will. I see there is a few questions in the thing. Yeah.
Absolutely. Yeah, the chat's getting a little live here. I think, folks are buying into this conversation, which is great. But Colleen, I got to toss it back to you because I know we want to hear more from Lisa, some of the things that are going on the ground that she's involved with in her organization.
Yeah, we want to bring back Miss Lisa. We just want to hear a little more about the work that you're doing with Safe Streets, Safe Neighborhoods. And I want to give you a space, as we've done so far, if you just want to respond to the conversation, anything that's bubbling up for you here, having heard from your colleagues. And then tell us a little bit more about what you're excited for, where Safe Streets, Safe Neighborhoods is headed.
Yeah, I was thinking about some stuff when Dr. Punch and Marcus was talking. I want to give a shout out to something that I don't know if you all really hear this, but I work directly in the streets. I tell people I work with the shooters. I work with the people that's been harmed by the shooters. But I do want to talk about the people that's in the street, that's hustling, that's dealing, that's helping us stop some of the violence that we have to go to. I don't think that, I was in a meeting last week and I told them, I know this might hurt some people feeling, law enforcement, but we got people that's in the background, that's doing things, that's stopping things. We got a big thing going on right now in St. Louis that could really bring a lot of shooting to this city right now because someone got shot 2 weeks ago. And he was a major player and they want their get back. And they've been pock shocking at each other. But I've been talking to both sides, the leaders. And even though they're doing what they're doing in the street, they telling their people, y'all got to stand down. And it's been working. And we've been doing this, having these talks for a long time. I'm not going to only talk about what Safe Streets is doing because also we have a program, Show Me Peace. And their people are out there, working with some of the people that's causing the problems, bringing people together that can stop some of this. The little oaks, they wild child, they the shooters, but you got people in the background that can say, hey, look, y'all, stop. You're messing with our money. You're messing with this. And I know this might not be an approach that some people like, but this is what we have to do to stop some of the shooting and the crime that's in St. Louis. St. Louis is unique because there's kind of a lack of respect for the old heads. I want to say that. When I say that, I'm talking about old heads, 30-year-olds, and those that are still in the street. The youngsters sometimes don't have respect for what, and so we have to, go in and talk. The mayor initiative, the mayor here had an initiative for the summer for the kids because we thought it was going to be a really, really bad summer this summer because of a lot of shootings that went on. We thought it was going to be a lot of retaliation, but we got out there in the streets. We talked to the shooters. We talked to the people that's been affected by the shootings, and we were able to get some peace treaties. We had kids that were coming to the centers, the youth centers, and throwing parties and stuff, so that they wouldn't be doing a lot of shooting all over the city. Let's bring them to a point. And I'm gonna tell y'all something. These kids come with their guns. And in Missouri, they can carry their guns. They're allowed to carry their guns. That's the law. And so, when they come inside these safe spaces, we tell them you can't bring your guns in. Even some of the kids, I had to take their guns and put their guns up. And after the party's over with, I got to give them their guns back because it's the law. But what I seen happen with this is the last 2 parties we had, a lot of the kids that were carrying heavy guns didn't even bring their guns to the party. And so I think that was something big that we accomplished. And so I do want to talk about that. I want to talk about the OVP, Will Pickney, bringing different organizations together, and we all working together. it's been big because, you know, we got people that not even able to pay for funerals. Just last week, we had a 16-year-old and a 19-year-old that was murdered, and the families didn't have any money. So Mission St. Louis, they stepped in and don't let me leave out family FCC, Mike Milton and them. Shout out to them. They paid for 3 funerals in 1 week. And so what I see, y'all, is I see more participation. I see more together. The stuff that I didn't see for the last 2 years, I'm seeing that now. I'm seeing different smaller organizations calling me on the phone saying, Lisa, is there anything that we could do? We'll volunteer, you know, we'll come out and we'll help. And so I think that was pretty good. Just this morning, a 4-year-old was killed day before yesterday. And Lisa Potts from the Mental Health Board, she called me. She said, Lisa, the St. Louis Public Schools want to get in contact with the family. They want to get them resources and stuff like that. So I think that we're really, really coming around. I think St. Louis is coming around. I'm seeing some of the organizations that used to be apart coming together, and I'm happy to see that.
Thank you so much, Lisa, for raising up so many other organizations and, you know, city agencies doing incredible work in St. Louis. Like, there are no shortage of people working really hard in that city, in our city, and that's how we're able to see the lowest homicide rate that we've had in a decade, because new collaboration and coordination and funding. The other thing I really want to highlight, you started by telling us some of the experiences you're seeing in the streets, negotiating peace treaties with folks, kids willingly giving up their guns. And I just want to emphasize that is possible because of who you are and the fact that you have been in community, being real with community for decades, and you have earned that respect. And I say that because it's a testament to you, and I want to give you your flowers, but it's also a testament to how crucial it is that we continue to invest in community, because we cannot have big entities swoop in with as many resources or as expertise as we may have and think that we can lead the way. It has to be led by those who've been in community and have the respect to earn the real change that's needed. So thank you for doing all you're doing. I'm gonna send it back to my brother Will.
Thanks, Colleen. Thank you, Lisa. Got to just lift up that last part too, Colleen, right? That Lisa, you've been so effective, Dr. Punch, Marcus, right, in this work we see across the country. Those that are best positioned are folks who have those relationships, right, can engage with folks that are actively involved, right, that know how to have the conversations, that can get somebody to put down a gun. And it's important that we name that, because as this work evolves, we have to continue to center those community organizations and those community members, right? We know law enforcement doesn't have those relationships, right? They're not able to have those type of conversations. We know real big nonprofits, right, that have tens of $1 million budgets, right? They're not positioned to be in the community and have those relationships and conversations. So it's critically important, right, that we continue to center community members that are best positioned to do this work, right? Because we've seen that when we resource somebody like Lisa, right, we know that there's a positive outcome on the other end. We know that there's a direct impact on reducing violence within community. And I think whenever we have these conversations, we have to lift that up, because we know when we invest in community, community gets it right, you know? So just appreciate everything that was lifted up there by both you, Colleen, and Lisa. Dr. Punch, I want to bring you back into the conversation, because I think Lisa started it off, right? Just in terms of relationship and how relationships are evolving on the ground in St. Louis. Each of the organizations on this call play a distinct role within that broader ecosystem in St. Louis. And the work being done is deeply, deeply interconnected. not just among the folks that are here on this call today, but also with the broader St. Louis community. So I wanted to ask you, like, do you see opportunities to deepen those connections between your organization and others in the community to better serve the people, right, that are most impacted?
Oh, great question. I mean, first of all, I do want to shout out the Office of Violence Prevention. Not every city has a convening space. Not every city has a funder. Not every city has a vision from both public health and public safety for what it is to create community safety. So, like, I think that decision that St. Louis made many years ago and has made in many ways over the years is why this is happening right now. And I can't say enough. To have a government structured convener is a real gift and very important. And not a lot of places have that advantage. I also think the thing that I hear us saying in many different ways, and also in one of the comments in the chat, is the concept of distrust and relationship. For me, I describe that as the consequence of bullet-related injury. I had a patient one time talking to me about what they were going through. They had been shot through the leg and actually lost part of their leg, had an amputation, and they were talking about their grief and their recovery. And I was asking them, why is it that a huge part of your recovery is to trust yourself and to believe again? And they were like, well, because bullets break trust. And that sunk in my head so deeply. And I say a lot of the work for the BRIC is to unbreak broken trust, because that broken trust is the root of violence. Period. I think the opportunities that I want to represent is the opportunity for the healthcare community to no longer consider themselves not a critical partner in addressing those injuries and that broken trust. Because real talk, the doctor in the ER doesn't have a lifetime of relationship to build on to have that trust, right? As somebody in the community clinic at the federally qualified health center doesn't necessarily know you like that. If you're 19, you ain't been to the doctor much to get a couple shots. You're healthy. That's not where you're at. So what does it mean to create a structure which cultivates and unbreaks broken trust? I think that is possible for anyone, should they decide it's a priority. But you're not going to consider it a priority if you think the problem isn't yours. So much of the work of the BRIC is to pull the healthcare community into the ecosystem where it has previously been absent, and to help it recognize, first of all, there is real physiologic clinical care that is needed for people, even with minor injuries, that's currently being missed. I know that for the last 3.5 years of observing bullet-related injury in people who were sent out from emergency departments. But also, there is a tremendous opportunity to have a richer, better, more human-centered discourse with people and families when a bullet-related injury has happened. Those two things are the core component of our newest effort called BRIC Institute, which is us putting these best practices and structures into place so that any healthcare provider who is interacting with people who have bullet-related injury can simply do better without wearing themselves out, right? So often we want the hospital to be everything to everybody, and it cannot be. But a few small changes can make a lifetime of difference. For instance, one of the tools we use is something called a BRIC box, which is a box of supplies people take when they leave the hospital, so they have what they need to care for their wound. But the last part, to me, that is absolutely pivotal is what I have discovered even inside myself. I feel like so much of this work has been pivoted on me understanding how I have bullet-related injury, that secondary trauma, vicarious experience of what it is to have had so many beautiful Black men bleed to death in my hands. That radicalized me. But the work now is for me to heal from that. And I think I'm really, really worried about all the CVI workers and all the people in the ecosystem across this country who are doing this work who have not been given the opportunity to heal because this medicine doesn't exist. We don't understand what that broken trust is. We don't understand how bullet-related injury disrupts every single part of our nervous system function. It impacts how we eat, sleep, move, and think. It impacts our relationships. It impacts our relationships with ourselves and our own bodies. So much of the work of the BRIC is to elevate best practices and to get better medicine in people's hands, but also to create the conditions of healing for the healers. So I want to richly invite everybody on the call to BRIC Institute. It's happening as a launch November 7th to 9th, and then we'll continue forward with a number of different virtual and in-person offerings. We're so excited to be able to share this practice. Most of all, shared to not just share the best ways of doing the medicine, but opportunities for healing for the practitioners themselves, whether they're a social worker, a nurse, a trauma surgeon, or somebody who works in the diversion program in a criminal justice setting. Whatever it is, we think that we have some medicine that you need and the people you care for need. And we're super happy to share it as part of the St. Louis community. Listen, St. Louis is the frontier of the modern civil rights movement. And people like Lisa have been pushing and pounding the pavement for years for people like me, newcomers, to be able to be part of this movement. And we think it's a place of devastation and loss, while it's also a place of profound transition, transformation, and healing. And we're so excited to share this resource with people in the region and across the country. So that's BRIC Institute. It's November 7th to 9th in person, and there'll also be some virtual options as part of the Institute.
Dr. Punch, thank you. BRIC Institute sounds like an exciting opportunity, not just for folks in St. Louis, but for everybody around the country. And I'm so glad you invoked this idea of the need for healing, right? The need to get the medicine for the folks that are in the work, right? Marcus, I know you've seen it, you've talked about it, right? Lisa, we were literally just talking about this, yesterday, right? The need for folks on the front line, folks within the ecosystem to really access that healing, right? So I want to push all of us, right? Those on the call, those that see this recording, those that hear about it, right? Let's take advantage of opportunities like the BRIC Institute and really begin to lift up how we get that medicine, right? Like what we're doing to keep ourselves whole and well as we move through this work. I just personally want to thank all of you for the work that you're doing and your contributions to today's conversation. And Colleen, I'm going to toss it back over to you.
Hey, Colleen, can I say one thing real quick?
Of course, yeah.
Just one thing, and when Lisa spoke, it made me think about it. Like, and I've been talking about this comprehensive and how I love that, and I say, times are changing and stuff. But I want to be clear, and I stand on this right here, and that's why. So shout out to Lisa mentioned we got the Show Me Peace team that are on the ground, boots on the ground. I love all the parts. I love Dr. BRIC, but I mean Dr. Punch. Okay, I'm so the BRIC, but you got to have boots on the ground doing the work on the front end, man. You can have all the other resources, all these innovatives and long-term stuff, which I love prevention, but everybody don't do that hardcore intervention. You got to have that because they're going to be able to get to places that all the other entities, law enforcement included, school programs included, hospitals included, they can't get to stop it on the front end. And even after Dr. Punch is dealing with them folks with this healing, there's still retaliation in the air, and Lisa knows this. So you can't get away with doing this by not getting the practitioners from the ground, which we call the credible individuals, and giving them a shot to be the lead of this work. Everyone else, we can look at great wraparound services, but when you want to stop violence right now at the best of the ability, you got to have boots on the ground that are trained in mediation and consultation on them streets. And Lisa knows far too well about that. So she sparked that for me to say that, because I don't want to come off as the ecosystem guy. I know damn well you got to train folks on the ground. That's why I'm so much always gone, because that's first and foremost. Violence doesn't just stop from a resource. Thank you.
Thank you. I'm gonna keep us on time here. My deepest gratitude for all of you for who you are, what you are doing in community, and for being with us today. It was such an honor to begin this conversation with you all. Thanks to everyone who joined us. There were a few private questions I hope that we answered. I wish we had more time. Maybe we'll schedule a follow-up conversation because there's so much richness here. So thank you all so very much. I hope everybody has a beautiful rest of your day. Bye.